Hi everyone, this is Dr. Praveen Patil here. Today I am going to talk on the mouth ulcer. So in this topic I am going to cover what is the causes for mouth ulcer, what are the symptoms of mouth ulcers, and what the primary remedies for the mouth ulcers. So when you look into the mouth ulcer, so if the 100 people are suffering from the mouth ulcer, among them, so 30% of the people will end up with the recurrence of the mouth ulcers. It hurts them a lot. So they can't eat solid foods because at the time of eating of the solid foods it hurts them. They can't use spicy foods, and sometimes even they can't laugh properly. So what are the causes for this? What are the causes for the mouth ulcers? So the available causes, when we list it out, so we can categorize all these available causes under three main categories. So one is immune dysregulation, second one is decreased mucosal barrier, and third one is antigenic hypersensitivity. So we'll look into one by one. The first one is immune dysregulations. Then what is the immune dysregulation? To understand this, I wanted to give you an example of a policeman. If the duties of the policeman is to maintain or prevent the illegal activities. So in case if the policeman himself only get involved in the illegal activities, then there will be a disturbance in the society. Is it or not? So in the same way, the cells which are meant to protect us, so sometimes they behave differently in our body. So mouth ulcer is one of the result of that. Then what are the causes for this immune dysregulation? So we don't know exactly what is the causes for immune dysregulation, but as per my opinion, I feel not following of the Dinacharya, Ritucharya and Sadruta may result into these kind of things in our body. So what is the Dinacharya? Dinacharya is a daily routine. At what time we have to get up and what should be our routine, and what to eat, what not to eat. And Ritucharya as a seasonal wise regimens. And Sadruta, how to think, how to handle the situations. Many people may get surprised when they come to know that there is a relation between the mouth ulcer and the mental health. Of course, there is a 100% relation between the mind and body. So, for example, if you have exam, so because of exam tension, we may get the mouth ulcer. And if you are not able to sleep by any reason for 4 to 5 days, so there will be mouth ulcer. So next comes a second cause, that is decreased mucosal barrier. Mucosa is the innermost layer of the mouth. So anything which is decreasing the thickness of this mucosa, so that will become a cause for these kind of mouth ulcers. Next to the immune dysregulation, that is 40% cause in the recurrent ulcer. So next commonest cause is decreased mucosal barrier. Deficiency of vitamins, minerals, iron, folic acid, etc. So that will cause a thinning in the mucosa, buccal mucosa. So that will result into the formation of the ulcer. So mucosa will become very thin. So there will be ulceration formation. Then where to get these vitamins, these minerals? So these are available in green leafy vegetables, egg, milk, soya. Sometimes chewing of tobacco, smoking, so that will also decrease the mucosal barrier. Then what is the solution for this? It's wise to quit these habits. Some women, they face mouth ulcer a week before the menstruation. So this is because of the thinning of the mucosal, that is because of the hormone influence. So proper hormone regulations takes place by regular morning exercises, a morning walk, and mental peace. So that will be a solution for that. Next one is antigenic hypersensitivity. So there is more number of microorganisms in our body than of our own cells. These are opportunistic in nature. So whenever our defense mechanism becomes weak, there may be a chances of appearing of the mouth ulcer. So I recommend repeated mouth gargle with salt water or plain water 5 to 7 times a day. Another important thing is SLS, sodium lauryl sulphate. So this chemical will be there in many of the toothpaste. So it is the detergent molecule for the frothing purpose they add into the toothpaste. So some people, they may be allergic or hypersensible to this SLS. So the people who are particularly getting a mouth ulcer with a particular toothpaste, so better to shift into a non-SLS toothpastes. Too much usage of chocolates, coffee, that also leads into mouth ulcer, and there are some medications which may cause mouth ulcer. So for example, the medicine which is kept to deglute, so if you are chewing that kind of medicines, so that may leads into mouth ulcer formation. Apart from the diseases or the deficiency of the things or lifestyle, so apart from this, there are some secondary mouth ulcers which appears because of some systemic disorders like irritable bowel syndrome, Crohn's disease, ulcerative colitis, etc. For this, better to consult a physician. It has to be treated according to the disease. So next comes the symptoms. What are the symptoms we get? So cardinally we get 3 symptoms, that is pain, burning and ulcer formation. And the treatment is, as per my opinion, we have to go for regular morning walk to get proper hormonal regulations, and it also gives a stability to the mind and it will be helpful to handle the situations. Repeated water gargling will reduce the microorganism growth in the mouth. Change the toothbrush on every 2 months and use non-SLS toothpaste. In spite of this also, if you get any mouth ulcer, then apply honey over that, honey over the mouth ulcer twice in a day, and take some turmeric powder, mix with the water, and that paste you apply over the ulcerative part at the night. So in spite of this, within 1 or 2 days you are not getting relief with the symptoms, then better to consult your physician. This is all about mouth ulcer. Thanks for hearing me. Thank you one and all.